Okay, everybody, we would like to get started with our next panel. So we are here today to talk about the health disparities of climate change. My name is Lauren Padilla. I work for the Environmental Defense Fund as part of an air quality team that is collecting and analyzing air quality data to try to reduce emissions and improve human health around the globe. And this is just one component of how climate change can impact human health. And we have a great lineup of speakers who will be touching on all the many other ways that that climate impacts us as humans. So I would like to start with introductions from each of our speakers, and we'll begin with Andy.
Sure. My name is Andy. No? You could probably yell it. My name is Andy Stevenson. There we go. I work at VoLo Investments, and I also have been with the VoLo Foundation for about 3 years, working on climate, the financial elements of climate change, the financial impacts of climate change. I've also spent a lot of time focusing on the healthcare impacts, historically from the Clean Air Act, and that's what I'm going to be speaking about today.
My name is Dr. Ava Holt, and I'm a postdoctoral scholar at Florida State University. And we're over a state program funded by the Center for Disease Control. So we're called Florida Building Resilience Against Climate Effects. And it's an initiative that's across 16 states and 2 cities that promotes public health preparedness and adaptation to the current potential impacts of climate change. And I'm coming from a perspective as talking and dealing with from the state level, but also from a county level as well, because I actually work hand in hand with some of the local health departments here in Florida.
Hi, good afternoon. I'm Dr. Cheryl Holder. I wear 2 hats. I'm an internist HIV treater. I'm an associate professor at the Herbert Wertheim College of Medicine in the Department of Humanities, Health, and Society. And I'm also co-chair of the Florida Clinicians for Climate Action. And for over 30 plus years, I've basically worked in the communities of Miami-Dade County, the poorer communities, treating HIV ill, sick, poor population, and then now teaching medical students how to use the social determinants of health in making proper assessments of health and getting the outcomes that we want. Thank you.
Thank you. So thank you all for being here, and thank you again to UCF and the VoLo Foundation and the organizers. And I think we can just jump right into our first question, which is for Dr. Holt to lay some of the groundwork for us on what are the biggest human health impacts that you're seeing as a consequence of climate change, both sort of more locally at the county level and then broader picture, outside of your area or even Florida.
Okay. So as most of you know, all people are impacted by climate change. So the most vulnerable to the health impacts are the same populations that are experiencing health inequities. So you're looking at vulnerable populations that include low-income families, communities of color, people with pre-existing chronic conditions, pregnant women, children, elders. And you also have to keep in mind there are people that work outdoors. So you're looking at farmers, particularly immigrants, who may not have health care. And in addition, here in Florida, we have tribal nations. So the individuals that are most vulnerable to the impacts of climate change, these are the people that we want to focus on. So addressing climate change could be one of the most represented and best opportunity to improve public health. So what is it that we're seeing? So here, what you have is those climate change impacts health through climate changes or environmental changes, such as extreme heat and other severe weather events, a decline in air quality, more frequent wildfires, increases in allergens, increases in cardiovascular diseases. All of these things that we're seeing now, it can be something as simple as mental health impacts. Sometimes we kind of look over that particular area because if you think about a hurricane coming in and the post-disaster activities that go on, people lose their homes, people lose their jobs, they get displaced. So there's an impact for anxiety and stress and post-traumatic stress disorder. Also, there's injuries. And from what we see with the rising temperatures, you get heat-related illnesses, cardiovascular diseases, and sometimes death. So what we see here in Florida is sometimes there's an increase in hospitalizations and emergency department visits. So a lot of the counties that I work with, they tend to focus on extreme heat. So they go out and they educate different communities, especially vulnerable populations, about what they can do to prevent some of these different issues that are going on across our state.
Thank you. And I'll add one in there with mosquito-borne vectors.
Absolutely.
Yeah.
From when we see the environmental changes, you see an increase in different vector-borne diseases such as malaria, Zika virus, West Nile virus. So what we try to do is you put in mosquito repellent and kind of look at how our water is being infected as well. So you're looking at our food supply is getting impacted. Our water is being contaminated. So those are some of the things that we have to look at. There's an overall health impact, and we have an opportunity as individuals to do something.
So the next question goes to Andy with the economic perspective. What are all of these ailments costing us?
Sure. I was going to do begin first with a kind of a history of where we've been. Oh, do I have a clicker?
That would be great.
Sorry. I'm trying to tell the good news story. There is a good news story here that we can take some heart in, which is sort of the public health impact on CO2 emissions already, that we've already seen through efforts through the Clean Air Act. So I'm going to start with a little bit of history, but not much, but just to give you a sense of just how powerful the Clean Air Act has been over time, what's it done for us as Americans, the economic benefits of the Clean Air Act, and why it has already helped us move down the road to solving climate change and should give us inspiration that we can actually get this done. Just to give you some high-level benefits from what the Clean Air Act has accomplished. First of all, it was put into place to reduce air pollution, toxic air emissions, acid rain, and ozone depletion. Those were kind of the principal areas that it was to be focused on. What are the benefits today? Over 3 million cases of asthma avoided, 250,000 American lives saved annually since 1973, an incredible driver of public health benefit. About $3.4 trillion just from the reductions in acid rain. Hundreds of millions of Americans saved from fatal and non-fatal skin cancers. And even in the state of Florida, to give you a very short-term view on this, as much as 40% of air pollution deaths have been reduced over the last 15 years just due to improvements in three particulate matter, NOx, and SOx. So just three chemicals that have been taken down over the last 15 years, and the benefits to the state of Florida have been pretty significant. Oh, let's back one. How do you back one? I think overshot. Can you back up? Red. There we go. That's all I have. So I can actually. So let's just quickly look at what the Clean Air Act did. It did an incredible job of reducing lead in gasoline. A lot of people think about that as something the Clean Air Act has created as a benefit. You can see what's happened to lead in gasoline over the first 20 years of the Clean Air Act. It also obviously worked very hard to reduce emissions across a wide spectrum, but the most damaging ones are sulfur dioxide, nitrous oxide, and particle matter. Oops, did it again. Round two. Oh, sorry, what are the specific healthcare benefits? So this is something that we really don't spend a lot of time on, but it's incredibly valuable to understand. Mortality rates went down significantly. Chronic bronchitis, boy, is that looking, that looks okay under there. Chronic bronchitis rates, hospital visits, all were significant numbers brought down due to the benefits of the Clean Air Act. lost work days, 22 million, restricted activity days, 125 million a year. These are all benefits that were we invested in as a country, and we yielded incredible healthcare benefits just by tackling these problems. Quickly going into the next 30-year phase, again, focused on reducing air pollutants. And again, we saw tremendous benefits. So if you look at the total number of lives saved from the Clean Air Act, it's upwards of about 450,000 lives a year when you kind of take into account all the benefits that we've seen over time. 450,000 lives a year is roughly what we lose to smoking every year at the moment, just to give you a sense of how big of a scale that is. And again, all the benefits that across the economic sector, which are lost work days, a lot of people wouldn't be showing up to work, lost days for school, bronchitis, a lot of these are very long-term illnesses that have a very high economic impact on our economies. Then we look at the cost benefit of what we did, and this should give us some hope that you can solve this problem without costing an arm and a leg. You can barely see the benefit of the costs on the left and the right-hand graphs. There's those little blue lines, but are on the order of $40 to $80 billion a year, where the average costs of actually fixing these problems. And then the benefits that accrued to the public were in the trillions, or upwards of $1 trillion. On average, about $1.6 trillion in the first 20-year phase and about $1.2 trillion in the second 30-year phase. So these are huge public benefits that we would not have had without this work. Okay, so what does public health have to do with climate change? When you talk about the emissions from fossil fuels, you're talking about, obviously, carbon. People all think about carbon, but there's a lot of other things that are impurities that are in the fuels that come out as particulates, for example, particle matter, which can get into your lungs and is very difficult to release from your lungs once it's in, sulfur dioxide and nitrous oxide. These are all principal components of negative health effects for the American people. If you look at this graph, you can see that the sulfur, especially just focusing on sulfur dioxide and nitrous oxide, these graphs have all gone down quite aggressively over the last, call it 40 years. No, sorry, this is only 30 years on the chart here. And the amount of CO2 we use in our economy has also fallen kind of along the similar lines. So when you are addressing these healthcare benefits, you are also addressing CO2, and we have been doing that for decades now. And then this one is, with the help of the work that we've been doing at MIT, gives you a sense of when we talk about the social cost of carbon, people hear about that word social cost of carbon. They say, okay, that's some kind of vague idea of how we're supposed to think about the costs of CO2 to us today and going forward in time. As we all know that these costs are going to rise over time, given the damages that we've seen from hurricanes, wildfires, floods, et cetera. These costs are going to be amplified over time as the planet gets hotter. What I wanted to highlight here is that we've had a tremendous success story from what are called the co-contaminants from the CO2, which is the decrease through the Clean Air Act of all the particle matter, the NOx and SOx. If you turn that into a social cost of fossil fuel combustion, you'll see that those prices have come down very aggressively over the last 15 odd years. So it's quite a testament to what we can do and the public benefits, the health benefits that we've seen from actually operating through policy to drive down our healthcare impacts from fossil fuel consumption, which are, obviously there's carbon, but there's also the particulates that have a pretty awful impact on young people, old people, everyone in between. And just trying to highlight the fact that we've had a very long history of success in this space, and that we should not think of carbon as something that we can't tackle.
Thanks. So we're definitely seeing some issues. There's a cost. There's some hope, but I want to hear from Dr. Holder what she's seeing on the ground as a clinician.
Yeah, this is great that we're focusing on solutions, and I'm hoping to bring it to the level of what I see, the patient level. We've been getting all the data. As a physician, I've benefited greatly from all the improvements in the Clean Air Act especially in the poor communities. And if you've lived in areas like in California where you've seen smog in the 60s and 70s to so much cleaner air now, you can attest to the changes. But as we learned just in the previous panel, if anyone was here, Elizabeth Soto said something so amazing, and which we take for granted, that much of the data comes in, but until the messenger is the right messenger, how do we listen? How do we respond? And for me, this one? I'm the worst at this stuff. Okay, the messenger. What alerted me when I've been treating patients for 20 plus years, yet it wasn't, she's a composite, but I want you just to remember her face, because this is much of the woman that I see. 60% of my visits are women, many are older. They're at the level where they're basically surviving on Social Security or whatever disability incomes. They're low income, and they have multiple medical problems, and they live in a community and housing in South Florida that may or may not have air conditioning. If they do, they often can't afford to pay the light bill. And at the end of one of my visits, she came in because her COPD was exacerbating more. And this was about 2016 when, that was when the first time we got the alarm. This is one of the hottest years ever. And it was the hottest July. And she came in and she needed her inhaler renewed earlier than ever. So I was renewing it. And I know for her, an inhaler is about $50. If we subsidize it, she still has to do an increased copay, which is not what she budgeted for, but she had to get it because she couldn't breathe. And then at the end, she slipped me the paper from FPL and said, could I sign this so she could get 3 months free from FPL because she couldn't pay her light bill because all her other costs had gone up and she was buying her inhalers more, and that $50 took away from what she could pay for her light bill. And when I read the requirements in FPL, the FPL requirements also didn't really cover her because she wasn't on a machine, she wasn't on a oxygen concentrator or something, but she was being impacted because what we know starting with climate change is the allergy seasons are starting earlier. So those few weeks, 3 months that we may take for granted when you live in substandard housing where you really can't close up all your windows and you may not be able to protect yourself, you will have more cost. So I did what I could. I wrote a letter, I tried, I couldn't falsify the requirements, and we tried to get her some more inhalers. But Miss Ella May, Anna May, I just use that May because so many of my patients and who are in that generation migrated from the Georgia, North Carolina, migrated to South Florida for a better life, and they were now struggling. And we hear about the hottest days, and we complain, and the nighttime temperatures. You heard earlier in another presentation, nighttime temperatures are real important, especially for women. To sleep, and which is a huge problem in America, you need 73 degrees, pulse around 60, you'll sleep like a baby. When my nighttime temperatures, and especially in my communities where you can't get the housing temperature down because outside is still so hot and they didn't have air conditioning, they can't sleep. And their asthma worsens, all their conditions worsens, mood, everything worsens. We go on and on. This is one of my other patients. He's a lovely gentleman, and he agreed for me to use his picture because that really is him. And he's a street vendor. If you're in Miami, in a certain intersection, you can buy the fruits from him. He lives in a shack in a little converted one room behind the house in Little Havana area. And he's, won't tell you his real status, but he's in limbo immigration-wise and working on it. So he doesn't have any way of getting into real jobs, and he has to make about $300 a month to pay. So despite his kidney problem and his cancer, he's still on the streets of Miami. So when it gets really hot, I say, please do what you can to come in because it's only gonna worsen your condition. And he tries, but he knows he must work. One of my medical students was in Alabama when the tornado went through, in the poorest community in Alabama. My patient, I think this picture, my vision's terrible, but that's Maria, and that really is one of my patients who, she came to me after she delivered, because I'm an internist, but if you have no insurance and you're homeless, that's the population that I care for. And she had just had her baby a year or two ago, and the baby, she had Zika. Thank God the baby is supposedly all well, but we know how it is. And she still struggles with her depression and caring for the daughter and hoping that the baby is well. And you remember a few years ago when Zika happened, and the impact, the economic impact that had in our South Florida, but nobody talked about the economic impact on the individual and the emotional crisis. And then I get to Miss Big Twigs here. This was in the newspaper. This fight started over a fan. A fan in their home. Miss Twigs was fighting with her daughter, and after that fight, she got arrested. She was brought to the Broward County jail system. In her appeal in front of the judge, she kept coughing and complaining, and the judge says, I don't want to hear about your cough. I don't want to hear about your what's going on with you. She eventually got released, went back to the apartment, which was too hot, internal temperatures too high, exacerbated her COPD. She died 3 days later. Now, the health literacy there of that judge, if she understood what was involved, I think she may have responded differently. If Ms. Twiggs' physician had understood a little bit more what was involved, would he or she have done better education? It goes on. We know what goes on with fossil fuels. We know asthma. I want you to pay attention again to the pictures. Children, old people, black people. More black and poor people live next to the pollutions. We know this. This has been data for many, many years, and there's been a big fight in climate justice and environmental justice for a very long time. You've seen this picture, and we've seen our vectors. You know about sea level rise, you know about flooding and the high waters, and we now have climate gentrification, which means I have a patient who used to live in Little Haiti, and she came to me later. Again, her diabetes worsened because she now lives on the couch in North Miami in a family because her landlord in Little Haiti didn't renew her rent because of one mispayment or some lots of confusion. Anyway, he used an opportunity to kick her out because Little Haiti now is high ground and so expensive that he wanted to empty his building. So she ends up on the couch and her diabetes decompensated. And you see all the high ground areas are now the poor blacker, the working class poorer communities that after Civil War in the 1800s, which is how Florida was developed, especially in South Florida, where black and brown people were not allowed to live with the white people, and they're relegated to the poorer parts of the world, which happen to be along the railroad tracks. And as all the engineers in here know, railroad tracks are installed in high ground and stable land. So these communities are now in the area of high ground and are now much more desirable. And where do these people go? So my patients now are being sent to Homestead, so they're taking an hour and a half to come to see me in the mornings because it's so far and there's no public transportation. It just goes on, but it's clear that we know that vulnerable populations are impacted more. The black, the brown, the poorer people, the children, they're closer to the ground. The Maasai have a saying where they greet you and they say, how are your children? And I wonder if we do that more, we would have a much more clear understanding of the urgency of this because our children are even impacted more with all the changes. As the flooding waters get nutrient rich, which means it's bacteria, it's contamination, and they play in it. As the particulates drop lower and their lungs are more impacted. If you go to India right now, they're seeing lung cancers in people who've never smoked who are in their 20s and 30s. So we know the data, we know it's real. Those people who are impacted more, what are we going to do? We do need more information. And that's where we're hoping that with what we do as physicians, because we see physicians as part of the solution. The messenger is important. Just like my patient, Miss May, woke me up, we know that based on the last Gallup poll, the number one, who knows what the number one respected profession is that people really respect? Who is that? Number one.
Physician.
No, nurses. Nurses number one. And I see why. I tell all my medical students, listen, doctors are important, but you know who keeps you alive when you're hospitalized? Nurses. Nurses. If you want a good hospital, see how the nurses' ratio is. See how the nurses are trained. See how the nurses respond. Nurses really rule everything. And they are the most important person. After that are the doctors. But I gave this out to summarize how doctors we're trying to communicate. I gave them out most tables. I'll have some here. And looking at trying to get the message clear so we can show what are the most important health issues. How do you categorize it? What are some solutions? So as messengers, we can reach more people than, think about it, 1 million doctors in America. If you put 3,000 patients per doctor, each of those 3,000 patients reach how many more thousand? You're looking at 30 to 50 million, just even if it's only 1 and 1. So the messenger and our role as physicians and clinicians are crucial and vital to bringing the urgency and bringing it in a way that you can feel and understand. And I don't think you'll forget Jorge and Maria or Anna Mae after you remember this. And you go home and you find out who in your family meets some of these requirements. You have asthmatics, you have allergies, you have people with different problems. You yourself, when it was 100 degrees, how often did you go outside? How was your mood? And as physicians, we are here to help our communities adapt and be ready for the changes. And who else better to do this? So we see our roles primarily in being part of the solution and getting us to understand these Amish questions that they really use. Does it help my family and does it help my community? And as you get to those questions and you ask yourselves, how then can I achieve this? We hope we can work together in ushering the community and our patients to that point as we deal with climate change. Because the major prevention time is gone. Now we're adapting and mitigating and hoping that we all survive, knowing that some of us won't do as well, and those that won't do as well are generally poor, whether it's in this country or any other country. But we are all responsible. We may not be all guilty, but we're all responsible. Thank you.
Thank you. So, yeah, that's just really powerful about how the vulnerable are at the greatest risk, and then they're the least able to respond and become resilient after they've had one of these impacts. So I put it out there to all of you, what do you recommend for adaptation, or what does mitigation look like for these populations especially?
Well, from a state perspective, I'm working on a project with California. And as most of you know, they are a very progressive state. And what I have seen is they've brought together all of the different departments and programs, and they work together as one regional collaborative. So you have housing, you have agriculture, you have Department of Transportation, public health, environmental health. They all come together and they put together this climate action team. And I saw that from their perspective, they actually incorporate climate change and adaptation strategies into all of their programs. And I feel like this is very important, especially here in Florida. I see it more at the local level here in Florida, for instance, with Sarasota County. What they did in the first part of this grant, they did a vulnerability assessment. And what they decided to do was to focus on their access and functional needs group. So this is our disabled group. Were they prepared for emergencies? And what they did was they did a health impact assessment that gave them a little bit of information and some data that allowed them to kind of hone in on some of the needs that are required, things that we may be overlooking in this population. And what they did, they came up with a training program that actually trains this particular population on how to survive a disaster, who to call, giving them resources. I just recently came back from one of their training sessions. It is 5.5 hours long. I was not bored. I was just totally amazed at the capacity and how much the community cared about just that population. There were about 40 people in that room, and they actually rescheduled that particular training. And they do hands-on training as well. So I feel like that's a really big adaptation component where programs have to come together and find those solutions. And then they use those to kind of create possible policies. In Volusia County, they did a Beat the Heat campaign. And with that campaign, they focused on African American communities. They focused on the elderly. They focused on children. So they went out into the community, they gave training sessions, they did a radio ad where the administrator went out and he actually answered questions on the air about why extreme heat is going on, that it is climate related. Sometimes I've ran into county health departments here in Florida where you can't really use climate change. It's kind of a, can we call it something else? Sometimes at this stage, I don't care what it's called. Can we get a solution? Can we get it incorporated? And I felt like that was really important. So I'm seeing the communication aspect, the public education aspect, being able to give the literature in a way to where you cut down on the language barrier. So what I saw Volusia doing is they created everything they did in Spanish. They also have it in French. So I felt like that was pretty amazing that you can do that. You're getting the message out there. So right now I'm working with them to do some evaluation to figure out what strategies are working. Are they effective? Are they cost effective? Who am I reaching? So I feel like those things are really important in getting that stakeholder buy-in and keeping climate change in the forefront.
Yeah, just to echo that, I think you really absolutely need a plan these days. We've seen over the last 25 years, maybe $200 billion worth of damages in Florida related to climate change. So this is very much a disruptive, more like a nuisance factor that you really have to be considered to be part of your plan for next year, the year after, and the following year, because it's just too expensive historically for us to have no plan.
One of the solutions that we have in South Florida, which came out of one of the hurricane cycles, it's run by a physician. It came out of New Florida Majority and Nancy Mateer and a whole group of others, Vanessa, I forget her name. It's run by a physician now. Hurricane preparedness is very difficult for poor people, and because it costs about $200-something if you're going to get these things together, especially if you have medications. So what's been created are community hubs, and part of this hub with the health message is helping to get a supply of medications through the CARES program, getting no-cost or low-cost medications ready, having a system where they know within the community where they can get the water, where they can get supplies. Because if you're going to a shelter, you have to bring your own supplies, which a lot of folks don't realize, or if they know it, so why go to a shelter if I don't have any supplies? So these hubs are created so folks can get their supplies and they can go to safe shelters with the supplies that they collect before the storm. And they also can get medications. So a lot of some of the adaptation that's around disaster, and what we're hoping with the Florida Clinicians for Climate Action is mobilizing our physicians force, our clinician force early. And so by getting them prepared, educated on climate, educated on being climate communicators, how to get the message clearly, succinctly across to the larger group that's culturally appropriate, we can then have the group out there with their patients, with the communities, educating as much as possible so that they can be more prepared. So that when the call comes, if there's an emergency, what can I do? That the elderly will respond. They're not going to give up. They'll know that there are some resources here. So this is one of the solutions that we're looking at, is bringing it from the community, then linking it with the physicians who can help the community understand better what you need to do, and then all the other advocacy work.
Right, so the community, the education, the just the social supports. I'm wondering if there is also a business lever. What is the healthcare industry doing, or are there insurance companies that are noticing the rising costs, and what can they do about it, or what are they doing about it?
Well, they're doing less is the short answer. I mean, we've seen policies in Florida go down over the last 2 or 3 years in terms of insurance, and maybe some of that is due to the fact that these are people that no longer have mortgages, so they are not obligated to participate in the program, and they're getting on in years and would rather spend that money on something else. So that's kind of a bit of a problem, because these storms are going to get more intense over time. But if you look at who the principal actor is in Florida for insurance, it's the U.S. government. Only about 5% of insurance is private in the strict sense of the word. And those policies are underpriced, obviously, for what the damages that they are actually inflicting. So there is a bit of a time that from the private side, they won't compete, because there's no way they can compete with very, very subsidized public policies. Those policies are not, so there's nothing cast in stone to say they're going to be around in 10 years in the same kind of discounted fashion that we see them today. So unfortunately, the insurance industry just sort of takes a step back, and it's been doing this for decades. If you look at what the damages from climate change, who pays for them, the insured portion is about a quarter, the the federal government pays about a quarter, and uninsured is about half. So that's where those damages go. They don't really exist inside the insurance community per se. So unfortunately, they're not that engaged in the problem at the moment.
For the health side, there's some opportunities here, because it was not addressed as a climate change issue, but it's addressed as asthma and improving asthma outcomes, because especially since in South Florida, many of the population are on Medicaid, and the Medicaid HMOs have started to try and look at housing situation, look at mold, look at mildew, look at roach infestation, and trying to change and improve those conditions using the social determinants of health in delivering health services. Now, they haven't linked it to climate change per se, but some of those changes that come out of the health insurance, Medicaid managed care, has improved some of the living conditions of some of the children in it. Unfortunately, Florida didn't expand Medicaid, so there's still a large percentage of folks that are not in the Medicaid managed care world. But if you can decrease your ER utilization for some of these chronic diseases, you will see some improvement. So there's even more talk of finding a way to getting the screens on for homes, so you decrease your vector-borne exposure. There's some talk of having one room, that's public-private philanthropic partnership, and having one room air-conditioned in a home, and even trying to retrofit homes to have some sort of ways to have some heat protection, because especially in the elderly, they know the COPD rates will increase. Our elderly population on Medicare, often in the Medicare Advantage program, so those programs are becoming much more aware, not because of climate change, but in a sense, they just want to reduce your utilization. So there may be opportunity in working with these HMOs in trying to adapt and helping their communities adapt that are covered in their programs.
I had one more point to add on
Sure,
this, is
yeah.
that after storms, so we've done a lot of research on what happens after storms and how people spend money after storms, and one thing they neglect is their health.
Yeah.
They spend money on fixing their home, fixing their car, whatever it takes to kind of get through that patch where some people don't even have a job because they're paid hourly. And so one of the the industries that sort of suffers, if we want to use that word, is actually the hospitals themselves, because they don't see patients for as much as 30 or 40 days after an event when, you know, there's pretty steady traffic for a hospital, and it really dips down precipitously after these events just because the costs are so overbearing and people are like, I can't afford to do it.
One thing to add to that is also the mental health component. Often that goes just totally neglected. There's stress, anxiety, those type of things that people are dealing with, from loss of job, loss of home, loss of a life. So I think there's room for the healthcare industry to just really step in and do something different.
You know, farmers, the last agricultural, the group that was here on agricultural, I hope they link in the health portion in whatever they do. One of the highest rates of suicide among farmers. They're 5 times the rates of the US, which is about 13, 14 per 100,000. They're 84 per 100,000. And that's increased in the last 2 to 3 years. And it's directly related to the loss of their crops, which comes back to climate change. Now, these dots are not connected easily. And many of the agricultural folks, you'll hear about the crops and the farm workers, but often they miss the farmers and the post-traumatic stress that's involved in losing your crop and the constant the losses that they've endured in the last 5 years have been tremendous, and you can often see that with suicide rates in most populations. So that's one area that I hope the agricultural world start looking at the health of their farmers and the farm workers and the land.
Yeah. So it sounds like there are some real opportunities I'm hearing, but there are also some places where we're really still struggling. You know, maybe the health insurance is incentivized to lower their costs and do more preventative measures, but on the damages side, it sounds like not so much. In fact, I was reading a FEMA article on the plane on the way here, and they're talking about disbursements of FEMA funds, and they're really not going to the people who need them the most. So I guess I have one more follow-up question about just solutions generally, and then maybe we'll open it up to the crowd. Back to what the healthcare industry can do and is doing. How do they handle the overflows and their increased utilization?
Well, the health system is not prepared for what we expect in the future. But especially with the heat illnesses in South Florida, the overall system isn't ready. What Florida has, unfortunately, is so many uninsured. So many of these problems may never make it to the emergency room or the urgent care centers because they really don't have the resources. So we may not see the increase that you would expect, but we anticipate higher numbers. One thing with Florida, our physician population is much older than most states. I mean, they look at psychiatrists, I think over 50% are over 65. So there's going to be a decline in the number of physicians that are capable to respond to this. So we anticipate an increased numbers, but our physician population won't be there to respond in the next 10, 20 years because of the large number of physicians in Florida that are over 50. So we know we're not prepared for what we're seeing. Right now, the data is not being collected well. We know there's an increase in hot days, we know there's an increase in asthma, we know there's an increase in allergies, but in a system that rewards visits, it's not totally a negative if your visits have gone up. So as we move towards what we call value-based reimbursement, then we might see the changes because readmission rates become more impactful. Not keeping the visits down may be more impactful. So it's going to be difficult. The next 10 years is going to be very important how we collect data because it's driven by so many other forces that has nothing to do with whether the patients are really ill. Because many of the early things we see, like diarrheal illnesses in children, if the mother is poor, they're generally not going to spend that copay money if they're insured. And if they're not insured, they're not going to spend the money, as we know, for a diarrheal illness that might be self-limiting. So that's the issue that we're going to deal with. It's still impactful that the child may lose school days, the parents may lose days, but how we capture the dollars and the health impacts, we're still deciding how best, and that's where we hope the physician involvement early will help us drive that.
Thanks. So, quick follow-up, I guess. In these areas where we aren't really prepared or we're not doing anything, and we talked about the need to have kind of ground-up, community-built solutions, but is there also a place for where we need some top-down policies to come in and really nudge people in the right direction at this point?
I'm going to start with that one. That is an absolute.
It's all you.
Leadership is so important, and everything starts from the top down. Often what I saw in working on the Cowboys program that I'm working with, what they do is a little different. I saw based on the region. They're a purple state, so if you're in a region where they're advocating for climate actions, you're in good shape. But if you're not, it's because priorities. Priorities is food. They're huge in agricultural areas. I believe it's the Central Valley area in California. And they kind of focus on the now. They don't look at later. So even here in Florida, I find that leadership is so important. Having that one person that keeps everything in the forefront, that champion in the community, the squeaky wheel does get the attention. So keep being the squeaky wheel. I know for a fact that when I don't get responses from people, well, they'll hear from me again. And sometimes I'll show up in person. Hi. I thought you might be interested in this. And it doesn't have to be called climate change. You can reframe it. And we have found that that's successful as well. Can we call it something else? Call it whatever. I feel like that leadership is the most important. And because we have such a young group of people, they're starting at the high school level. My daughter is 14, and she's like, Mom, what is it that you do? And she was like, don't you do this climate change stuff? I said, she told me, you need to go in and talk to the football players and talk to them about the heat exhaustion and heat stroke and making sure they get breaks. And I was like, so you know about that stuff. I did good, so I taught you. You go tell someone else. So leadership, be the leader. It starts with you. And elect those folks where you can get things done, where it affects you at home. Things affect me at home, I'm at the poll. I'm bringing my friends, I'm bringing my family, and you just really have to advocate for that. So absolutely, leadership, probably the most important thing you can do is be that leader and be that community voice.
Yeah. Well, as a physician, policy, I would love to take credit for some of the big changes and improvement in health that happened in our world, but we all know who are the public health experts out there. They know it was clean water, clean air, vaccines that did a lot of our heavy lifting. So policy, Affordable Care Act, the data is out, it has saved lives. Policy drives so much of the big improvements. Seatbelts, that's what saved lives, and that was a mandate. So policy is important, and hopefully as we educate and have folks understand why we need policy and effective policy, then we can make some of the bigger improvements in our health, especially when you're in an urgent situation, which climate crisis we're in now. And if you have 10 to 20 years, and I'm an HIV treater, and I think that's what got me into this also, where I'm such a believer. Because when I started in HIV, my patients were dying. I was going to funerals, we were holding hands, we didn't have that much. And when the activists got involved, and they were doing sit-ins, and they held the FDA accountable, and they pushed for the FDA to say, we need to get these drugs done faster. We, in 30 years, went from dying to being alive, to living an almost normal, long, healthy life, to near cure. And that was 30 to 40 years. And that happened for a huge group of people. 30-something million worldwide now are looking at longer lives. And we don't have to get HIV, and we're almost near a cure. So what drove that? Policy, activism, being educated. Now, there's some folks who got left behind, and we know so many reasons why, but you can't do it without good policy. You can't do it without the groundswell of movement of people saying we need something done. And so I know it's possible because it's only 30 years and we had a cure. So in 30 years, we don't all have to die from this heat.
That's right.
And even just on the policy side, if you think of the construction industry in Florida, which is a massive part of the Florida economy, if you're talking about 100 days a year with 105 plus temperature,
Yep.
that just can't be. You cannot construct buildings on a just as you wish basis. There's going to have to be rules in place to allow break rooms or shade spots or some kind of air conditioning accessible to the people that are doing that job, or more likely you're going to see the construction industry shrink, which I think is probably more the likely outcome, is because you just cannot operate in the same hours window that you used to. It's just not going to be practical, and it's obviously very dangerous.
And expensive.
And expensive, yeah.
Yeah. So let's take some questions from you all.
So, first off, thank you again for this discussion. It's been fascinating. I had a couple of questions for Dr. Holder. Listening to your accounts of your specific patients, I thought that was extremely powerful. And I noticed that you represent Florida clinicians for climate action. To what extent have you been able to connect with clinicians in other states to try and gather these stories?
Our clinician climate action got formed under George Mason University, and they were funded with a grant from Kresge Foundation. So it's not by ourselves. There's no way we can do this. And so the larger philanthropic organizations, they have a huge role. And Kresge Foundation, there are 23 right now throughout the US, clinicians for climate action. There's Wisconsin, Virginia, North Carolina, and our goal is to have them throughout the United States and working together in creating materials like what we create. And again, the push is at the clinician level to train the clinicians, educate the clinicians, Climate 101, and then train them in how to use the message to reach everyone about it. Because we have accepted climate change a human cause. We understand that. As clinicians, we will live the truth. We have to. And we've been doing this forever. We've been trying to tell people to lose weight, exercise, don't have a heart attack. And we've gotten pretty far. It may have taken a lot of time, but if you look at some of the data, what's really killing us more now is not so much the heart disease as much as cancers have really risen. So we've had some inroads. So again, we are experienced in communicating health impact of situations, and then how we can get that move towards advocacy and addressing the real solutions. Because if you look at the number one solution in our handout is about clean energy. We have to reduce greenhouse gases, and we know this. But it's how do we do it? But along the way, how do we do some of the other changes? Because, the little thing, climate solution is health solutions, but it is so true. If you eat less red meat, I got my cholesterol covered, I got less processed meat, I got my blood pressure under control. If most people go to climate, more plant-based, my diabetes gets better. People lose weight if they don't do too much dairy. As a matter of fact, if you eat more in the ways, whether you go vegetarian or not, if you look at the food usage, the top used dairy, red meat, of the red meat is beef and lamb. Those three things use up a lot of the climate consumption and the energy. So if you start going to mollusk and plants and chicken and fish, you already improve your health and you're being better with the climate. So there is a role that physicians can really link the two and show the bang for what we've been talking about forever, which is reduce your cholesterol, get some more exercise. And if we want you to get exercise, you got to have a decent environment outside that's not too hot and not so polluted that you can go exercise. Because my patients don't have money for Equinox and LA Fitness and all those places. So that's what we look at.
Yeah, really emphasizing the co-benefits for human health and the climate. Mhm.
I'm with the UCF College of Medicine, and we have a new academic health sciences center, and I'm just thinking about what you're saying with clinicians, and I was just wondering if they're already developing curricula for these clinicians of the future.
It's starting. There's a consortium that I'm part of that's run through Columbia that's worldwide in moving this curriculum. Medical school curriculum change is like a turtle. It's really tough. However, with the urgency, we have already gone to the licensing that evaluates medical school, the LCME. They drive everything. So they have accepted the ACP's statement on climate change. And as long as the LCME puts, again, the top-down thing, you have to, if they put the pressure on the medical schools, the curriculum change. But most schools now are looking at ways. We just did our review at FIU, and there is no mention of climate change in the curriculum.
Well, I know that the medical schools in Florida have collaborated to create curriculum on opioids. So maybe
exactly.
that same group could work with you.
That's
and,
what we're hoping
yeah.
to do. And not just, and all the consortiums around the country are moving towards curricular change. And the good thing is the students are ready. The students want this because that's what they're living in, it's their future. So I don't see as much pushback as other areas, but the medical students have a whole lot to learn. So we're looking at integrating it in their cases. And that's what we're, like these cases that you see here, we can break down the anatomy, the physiology involved in the changes that happens to your body with the extreme weather or the particulate matter, and then they'll learn it that way. So that's what we're developing through the Clinicians for Climate Action Association.
Would the same apply for nursing?
We're hoping, and public health is taking the lead a lot. They have, most public health schools already have classes in climate change, and many schools have some sort of electives, but the key is to build it in throughout the 4 years.
So I think we have time for about one more. Yep.
Are there local clinicians that can help us with advocacy here in Orlando?
Yes, we do have some. If you have one of these on the bottom, we have a network, and we can link you to the doctors in this area that are involved in climate action, and that can work. We have a group, we have doctors that are in our group from Tallahassee, West Coast, pretty much all over that will be able to work with you.
So maybe just to wrap up, since we are out of time, can we get in one sentence closing thoughts on what everyone in this room can do by next Thursday?
I'd say stay focused on the healthcare impacts, because you're talking about health is a very important driver, and not in one sentence, but people understand health. You know, people understand their kids' health, and it resonates a lot better with people than talking about climate change. So using this as a way of talking about solutions, it's really one and the same thing in many, many ways. So I find it to be very persuasive, and people understand it.
I would say be the voice in your community. I say that with a whole lot of passion because often young people have a big voice. So listen to their voices as well. So be the voice in your community.
Climate change is impacting your health right now. Your health, your family's health, your community's health. It's not 20 years away, it's right now. And just think about it, talk to folks, and you'll see how it is hurting you right now.
Thank you all so much for being here, and please join me in thanking our speakers.